I know you have been listening to this podcast and hearing me constantly talk to you about how much you should be eating every single day to lose body fat and build lean muscle, how to optimize your hormone health, meditation and mindfulness, and the importance of it, but also some natural ways to help alleviate stress and anxiety. And today, not only am I going to give you a deep dive into all that, but I have a very special guest who is coming on to give you the actual doctor's opinion on all of that. So Dr. Jessica Norton is a naturopathic doctor based out of Seattle. She specializes in sports medicine and helping people with anxiety, burnout, and overwhelm from a naturopath's approach. And in today's conversation, her and I get into everything that you want to know about what the doctor has to say about macros, intermittent fasting, should you do keto or paleo or the Mediterranean diet. We also get a deep dive into weightlifting, CrossFit training, HIIT training, resistance training, and which training really is the best, and also which trainings you need to look out for that can actually cause more anxiety. On top of that, we get kind of personal talking about some stuff with anxiety, panic attacks, and what some of the main causes are, but also some natural things with meditation practices and some natural supplements and herbs you can start incorporating into your regimen to help alleviate some of that stress and anxiety. I love this conversation so much because I know a lot of you guys, when you hear me talk about how you need to have a daily meditative practice or a mindfulness practice, you sometimes brush it off, or maybe that doesn't go on the top of your priority list. And the reason I love this conversation with Jessica is because she gets into the science behind it, of why it's so important. And as a naturopath doctor, the proof is in the pudding. Like why she also has her patients and clients incorporate a meditation or mindfulness practice because of the science that she explains in this podcast episode that is going to help you as well. So I'm very excited for you guys to listen to our conversation and all the questions that I asked her that you guys have sent in, but also just to kind of share like her knowledge and background and passion about how the body works as a whole. And a lot of the symptoms that you sometimes get or issues that you have, like weight gain or low energy or low testosterone or low estrogen or sleep disturbances or anxiety, all these things are really just a symptom of something deeper that is going on. And her and I talk about it in this conversation, how you can identify what's going on, but also some very specific actionable steps you can start doing to get your body healthy and whole and to optimize your health, your nutrition, and your fitness so that you can look and feel your best. So I hope you enjoy this episode. Make sure you subscribe and leave me a comment. I love hearing from you guys. So if you listen to this and you love it and you have more questions and you want me to bring Dr. Jessica back on, shoot me a comment or a message and let me know. But welcome to the Phoenix Rising podcast, and here we go. Hey, Jessica, I am super excited to have you on the Phoenix Rising podcast. I appreciate you coming on to share some of your knowledge about functional medicine, nutrition, sports medicine, and I'm excited to let everybody hear about your expertise.
Awesome. I'm so excited to be here. I love to talk about this type of stuff. So let's dive in.
Yeah, I can't wait. I was telling somebody, I was like, I'm kind of doing this selfishly just because I love having these conversations that I think it would just be fun. So we'll dive into all the questions that some people were asking that I'll bring up for you. But first, I want to just give you the opportunity to share a little bit about you and your experience with functional health.
Oh, good question. So let's see. I became an ND and I also do acupuncture in 2018. I kind of got into, before I actually used to work in finance. So I had like what I call a quarter life crisis.
Oh,
and I ended up, yeah, exactly. Right. Totally opposite. And I always thought when I was younger, I would go into medicine, but quarter life crisis happened. I was working in finance, totally unhappy. And I said, hey, I'm going to change. I'm going to go into medicine. And I was originally applying to like traditional MD or medical school.
Mhm.
And I happened to meet a naturopath at one of the hospitals in the area I was in. And I knew nothing about naturopathic medicine. So I started to talk with her and I was like, holy crap, like that's actually like how I want to practice and what I want to do.
Yeah.
So I actually, yeah, ended up finding out about Bastyr, which is the university I went to here in Washington, in Seattle, and then came out here for an interview and that was it. Like I was sold. So kind of by accident, kind of ended up in the kind of functional medicine space.
Yeah, and I love that because I think a lot of people aren't familiar with naturopath or functional medicine. And when even like in day-to-day life, I brought it up to some friends and because they're like, oh, I've seen so many doctors about like we were talking about prior to recording of like anxiety, or I've seen people about this and nobody seems to know what's going on. And I always tell them, I'm like, you need to go to a naturopath. And they're like, a what? Like, what is
Yeah,
that? Yeah, but I
exactly.
don't I don't know if it's different for you guys. Are you guys in Washington, do they recognize NDs as doctors?
Yes.
Okay.
So, yeah, it kind of varies state to state, which I think is a little bit part of the confusion. But
Right.
so here in the state of Washington, I'm basically practice under the scope of a primary care provider.
Hmm.
So, like my license says naturopathic physician. So, I'm able to order lab tests. I'm able to order things like MRI, can prescribe medications. Not everything can't prescribe, things like opioids, which is fine with me.
Right.
Um, but make referrals. I make sure you get your screenings and labs and all those types of things. The only thing we don't have are like hospital admitting privileges. So, but yeah,
Okay.
we're pretty lucky here in the state of Washington.
Yeah. No, here it's a little bit different because Florida doesn't really recognize naturopath or functional as legitimate doctors, which is frustrating for
Yeah.
me. But and so a lot of them I know have gone to chiropractic school just so they can function under that role. For anybody listening that's like, I have no idea what you guys are talking about, how would you explain the difference between a regular MD doctor that most people go to and what you do as a
Mm.
naturopath?
Oh, good question. So I like to think that we, are typically act in the space of primary care physicians, like your traditional MD. But we have a few extra tools. So I guess first, kind of education wise, we go through an accredited 4-year university, and then we have to pass our licensing or board exam, and then we have to get licensed in our state. So that's kind of first thing. We're legitimate.
Mm-hmm.
We're not out there just practicing in the wild. Second, when we do practice, I like to think that we have a lot of other tools at our disposal. So yes, I can prescribe a medication, but I feel like there are a lot of other things kind of in between that may come up. Let's take, for example, so I do a lot of sports medicine and pain management in my in-person practice, right? So say I get somebody who has something like rheumatoid arthritis. They come in, let's say for their knee pain. Yes, I'm going to do some manual therapy. I'm going to recommend PT. We may need to do an injection or something like that on the knee, but we're also going to talk about your nutrition,
Mm-hmm.
right? Because that can often affect, your autoimmune condition because so much of your immune system is in your gut, right? We're also going to talk about things like exercise, right? I want you to
Mm-hmm.
keep moving. So a lot of people are kind of surprised that they're like, I came in for knee pain. Why are you talking about what I'm eating and things
Yep.
like that? But I tend to think that we really do focus on the whole
Mm-hmm.
person. We have like 6 guiding principles that really dictate how we function, right? One is treat the whole person, right? So you're more than just your knee pain. You're more than just, that condition that you walk into the office for, right? We have to take into consideration, how is your stress affecting your life? How is, this pain affecting, your everyday function? Are you sleeping? Are you eating? Are you moving, et cetera, et cetera? Let's see, I'll just run quickly through like the principles. So treat the whole person. Doctor as teacher, like a lot of my time, I get to spend a little bit more time with my patients, usually about 45 minutes to an hour. A lot of that is just been educating you on your
Mm-hmm.
body, like how things are actually connected. Like, take the rheumatoid arthritis example, how that's connected to your gut health and how that's, how your stress may be causing more flares, et cetera, et cetera. So really helping to educate our patients is huge. We talk about the healing power of nature, right? We believe that the body wants to be whole, right? It wants to work in homeostasis. And a lot of times we just need to remove some obstacles that are in the way, tweak a few things, be it your nutrition or your exercise, and your body kind of knows what to do, but maybe might need a little bit of help along the way. Let's see. And then we really focus on prevention, right? We'd rather you come in before, you need the total knee replacement or, rather than later. What is this saying? Like a ounce of prevention is worth more than a pound of the cure. So really, I like to think we really focus on optimizing your health.
Yeah. Yeah. That's how I've kind of explained it to people too, especially like the easiest way that I've always seen it is like, I feel like traditional doctors treat symptoms, where functional and naturopaths, they're looking at what is even causing the symptom to begin with and treating the cause, as opposed to just like the Band-Aid. Right.
Exactly. That's one of our principles. Identify and treat the cause. I should have mentioned that. Yeah. Like really digging down deep and still like, okay, well, why do you have this? Why are you hypothyroid, or why do you have RA? Things like that.
Yeah. The education is a huge piece too. And I feel like I always like suggest to people, if you're working with a trainer, a doctor, a nutritionist, whoever, you want to be with somebody who's not just giving you like, here's a meal plan, or here's this, or here's that. They're helping you better understand the way that your body works, so that you are more aware and can make more informed choices and start to navigate life with that information. So like, yeah, somebody comes in with rheumatoid arthritis, be like, all right, let me explain the way the gut works and how it impacts inflammation, your joints, lubrication, all those things. So that when this happens again, you don't go pay just for a surgery because your knee hurts. You can actually implement the changes to help yourself.
Exactly. Like one thing I tell my patients, as much as I like to see you in office, like, I like to chat it up with you. Like my goal is to not see you. So if I can educate you and help you better understand, then I'm doing my job in my estimation.
Yeah. I'm curious, this wasn't on my questions that I had for you, but with people who are active, because a lot of people that listen to this podcast, they're working out 4 to 5 days a week, they're strength training. I'm doing air quotes that they eat clean, because that doesn't necessarily mean whole foods. It just means more so I pay attention to like calories, which is a problem in itself. What do you find are some of the biggest things that active people have that maybe are out of alignment, that they don't even realize is impacting things like stress, anxiety, sleep disturbances? They're not recovering well.
Yeah, I would say with the more active, a lot of times it's the sleep. Like sometimes, sleep is so important, right? We're going through different stages of sleep, and different things are happening for recovery in each of those stages. Things like growth hormone is being released during those deeper, non-REM stages, and not going through all that, you're not going to recover optimally. And I see a lot, especially with, my runners and a lot of, CrossFitters, they push themselves to the point where they start to do more harm than good, just because they're not giving that time for recovery. Another thing a lot of times, especially when people are pushing into like overwhelm and anxiety, I honestly like to look at the type of exercise that they're doing. A lot of times there's too much high intensity interval training or too much HIIT. I like HIIT. I'm a huge fan, but if you're also having things like anxiety, it can really spike your cortisol a little too much. And not having, I usually like to say about 72 hours in between each HIIT session can do wonders if you're, already kind of burning the candle, so to speak, at both ends and need a little bit more recovery time.
Yeah.
And then, like you mentioned, kind of that over focus on clean or healthy eating. I like to have a balance. I definitely kind of I take a whole foods based approach. I usually like to say I follow more of a 80-20% rule. I don't subscribe to any sort of really particular diet. I say, protein first, and then kind of you're eating. I generally recommend kind of 1 gram per pound of ideal body weight. If you're hitting that, like usually you don't have a lot of room for a lot of other junk. But at the same time, it's all about balance, right? We can't be so restrictive or so hyper focused that we forget to live our lives. It starts to affect our social life, because that's, again, another aspect of our mental health and wellness. So keeping everything in balance sometimes can be, I think, a little bit difficult for my, let's call them my overachievers.
Yeah. The type A's, that would be me, the overachievers.
Exactly. It's usually more about bringing you guys into balance a little bit more.
It's so interesting with what you're talking about with the HIIT training and like keeping rest time in between, because years ago, I mean, I've always been an athlete. I started out as a personal trainer, just traditional like lifting, things like that. Then got into Olympic lifting, then was introduced to the CrossFit world. When I did CrossFit, it wasn't for very long, but I was more attracted to the athleticism of it. One of the issues that I have was, number one, I didn't feel like I was getting any stronger. And I didn't understand that. Like, why are these workouts are nuts. Why am I not getting any stronger? But then number two, I didn't feel like I was actually recovering, and I felt like higher levels of stress. So, and I did it for, I think I gave it like a year or so, and then I stepped away from it, because one of the things that I've always told people when they ask about CrossFit, I'm like, I think it's great if you're not used to hard work and exercise and HIIT training, and you want to do it in a group setting, but there is not enough foundational stuff going on with learning how the body works as a whole. And you're doing a lot of the same moves over and over and over again. But also, you cannot go max out 5 days a week on your body and think that it's not going to rebel and be like, all right, now like our hormones are out of whack, our cortisol's out of whack. So I always try and tell that, I try and tell people do like, I think like 3 HIIT sessions a week is good. And then supplement outside of that, like do like a serious like resistance training where it's just focused on strength and lifting. And then maybe do a day that's just more endurance focused, where you're doing like, you're going for a hike for like an hour, and it's not like a lot of the intervals, and that's going to be the most balanced. But I've had a lot of people who are like, I can't do CrossFit, it gives me anxiety. I'm like, right. That's literally what they say. I'm like, well, yeah, it's because the amount of cortisol your body has to release to keep up with those workouts all the time, it's just not sustainable. But then that segues into, I want to talk about the other thing that you said with nutrition, because a lot of the questions that came in are about intermittent fasting. Should I do keto? Should I try Ozempic with you're doing exactly what I do when people do that. I like roll my eyes. I'm like, oh my God, you don't need to do that if you can just like eat balanced. Because I do know that a lot of times not eating enough like carbohydrates, fats, and protein can also cause a lot of issues with cortisol and hormone imbalances. So I would love to dive into this deeper with you, of your belief system as a naturopath around what's the air quotes, quote unquote, right way to eat to lose fat, maintain lean muscle while keeping optimal overall health.
Ooh,
I know it's loaded.
That's
I
a good
know.
one. That's a deep one. And I like to think it's actually simpler than we make it out to be. So first thing, intermittent fasting, paleo, keto, Mediterranean, DASH diet, like they're all ways of eating. Keep it simple, right? Unless you specifically have some sort of nutrient imbalance, unless you have epilepsy or you have some other condition, I kind of leave those to the side initially, at least. Again, I like to go back to just nutrition wise, whole foods based diet. I want you to, one, cut out the processed foods. If you're eating a lot of junk food, let's cut back on that first and foremost. Second of all, let's focus on, a balanced diet. I do tend to, when people want to work a little bit deeper with nutrition, I do focus on macros. I focus on protein, carbs, and fats, and keep it pretty simple.
Yep.
The whole, there's a whole debate about calories in, calories out. Doesn't matter. Some say it does, some say it doesn't. I think it's a great place to start, because it's, the basic metabolic function of, what you're consuming and turning into energy. How accurate is it? I don't know, you could debate that for the next probably 12 hours, right? You can deep
Yeah,
dive into that. But it gives us a place to start, at least,
right.
especially if you're looking on a fat loss journey. If you don't have no idea what you're intaking or have no idea how much, how many calories, how much fat, protein, carbs you're taking in, how else would you know where to start,
Hmm.
So, like I said, I like to at least make a baseline of, okay, an estimate of calorie intake, and I like to have people track for about a week. Make
Yep.
sure that they're including a weekend because that's when most people go off the rails and things
Hmm.
really change completely. And then from there, if you don't want to keep tracking after that, after you kind of get a hang of, the new eating style, that's fine. Like I'm not obsessive about it, but you need to at least have a baseline to know like what is your goal, right? How else would you know what 110 grams of protein looks like unless you actually track it for a little bit? So I start with that. So I start with the protein again, around 1 gram per pound of body weight or ideal body weight, right?
Right.
And then, vegetables, I tend to just say like, break them up to starchy and non-starchy. If at the beginning, if the person's not eating vegetables, I don't care if it's a potato or a carrot or a bell pepper, just eat it, right?
Yeah.
um, because so many times we let perfection be the enemy of making good changes. So I like to start with that. And then usually you're going to get your healthy fats either from your protein source or, how you're cooking your foods, your olive oils, your avocado oils, et cetera, et cetera. And then, nuts and seeds and fruits as well. So
Right.
just really focusing on whole foods. Like I just want you to cook, your protein and your vegetables at home 80% of the time. That's all
Yeah.
I'm asking for. And that's
Yeah.
where we start usually.
Yeah, you sound like that's literally what I tell people from the very beginning. They're like, okay, tell me what to eat. And I'm like, listen, the first week, I'm not going to tell you anything. I want you to just track what you're already doing so I can see your patterns, your habits, what macros you're missing. And same thing.
Mm-hmm.
Then we start to talk about macros. I'm like, I'm not super concerned about the calories. I don't want, like, I don't know if you get super specific, but I know a lot of the females that I've worked with, the women, I tell them because they get stuck in this headspace of like 1,200 calories. And I'm like, I don't want you going below. I'm like, the
You're not a
bare,
14-year-old child,
right. You have estrogen, progesterone, you have hormones that need more food. I don't let them go below 1,800 with even that is low. But I'm like,
Mm-hmm.
nobody needs to eat less than that. So, like, if you have to have like a baseline, don't go below that. Um,
Yep.
but yeah, I'm like 1 gram of protein per pound of your goal body weight instead of
Mm-hmm.
like, well, I'm 200 pounds. What's your thoughts on, because I also use the same approach, like most my clients, like if you saw their wheel of macros, it's split evenly across like carbs, fats, and protein. Are
Mm-hmm.
you a big believer in like certain amount of grams of fat, certain amount of carbs, or just kind of like splitting it down the middle?
I usually, if we've never done kind of any work and we're just getting started and, they haven't tried a lot of things in the past or haven't, had that experience of tracking, I will generally kind of split it evenly,
Mm-hmm.
kind of 30, you know, roughly kind of in the 30s
Right.
for each group. However, then as we have worked a little bit longer together and maybe we have specific goals, say they want to gain more muscle mass, I'll start to tweak it then. I'll start to maybe crank up the protein a little bit more, maybe dial back some of the carbs a little bit. But generally speaking, I like to kind of keep it even. It keeps it simple. People aren't freaking out. They don't get overwhelmed and they can just eat food without it sort of becoming, this kind of like orthorexic type situation.
Right. And then the funny thing about that is when you do that, your body kind of naturally settles at a weight that it can just
Exactly.
maintain without anything extreme. Like maybe you're a
Exactly.
pound here and there, but like the ones that are doing the intermittent fasting, the keto, the paleo, the Mediterraneans are the ones that I find like 1 month they're dropping 40 pounds and then the next month they're gaining back 50. It's
Exactly. They get those huge fluctuations, and heaven forbid they, have a little weekend where they kind of go off the rails or they go on vacation, then it's out the window.
yeah. Yeah, moderation, everything in life in moderation. I love too that you said stuff about nature because I was talking to somebody about this recently of how nature, because they were like, oh, I always feel better when I'm in nature. I'm like, well, of course you do. because
Yeah.
the brain is getting a chance to like cut out the stimulation, but also the negative ions that are created to help balance out the stress response. So I would love, because I said this, they're like, I don't know what you're talking about. So I would love if you could expand on how nature impacts us on a
Mm.
physiological level.
Ooh, good question. There's a couple kind of schools of thought on that. For one, I think it's kind of basic here is that you go out into nature, right? We get a chance to kind of shut down our prefrontal cortex, that part of our brain that's always like thinking about what I got to do next, planning and executive function and all the things you have to remember. You get to kind of switch that off a bit. You get to tamp that down. You get to really start to push into more of the parasympathetic nervous system response. So we have, the two systems of our autonomic nervous system. So autonomic being all the things that we don't have to worry about controlling, like breathing and heart rate and all that stuff. So we have our parasympathetic, which is our fight or flight, the run, the cortisol inducing, like go, go, go. And we have our rest and digest, which is our parasympathetic nervous system. Something about being out in nature really starts to help us tap into more of that parasympathetic rest and digest side of the nervous system. And that's when cortisol levels start to come down. That's when we're able to relax, we're able to breathe, and we feel good, right? Because I think that when we step out into nature, we kind of realize exactly how much stress we've been holding and how much thinking we've been doing over and over again.
Yep.
That's kind of one aspect. And then there's a whole kind of other aspect of thinking about like being out in nature and, electromagnetic fields of the earth and how that's actually affecting our body. And, like you mentioned, the negative ions and kind of almost in a way just resetting us and kind of returning us in a way to homeostasis so that, our body gets a chance to kind of reset in that sort of way. So I think that like the healing power of nature, it really is like there's something about it. It's just restorative. Like it's our natural right habitat, right? It's before we have all these houses and like things and electronics around us. It's like how our body, knew how to set our circadian rhythm and all those sorts of things. So getting out into nature is really powerful, I think.
Yeah, nature for sure. I feel like it just really puts into perspective all the things, basically what you were saying, that are occupying your mind that just does not matter. It gets you
Yep.
so connected to like the present moment because you're like, oh, look at the bird, look at the tree, look at this, look at that. So I love that. So then do you typically incorporate in your practice, and I feel like this is kind of a rhetorical question, with your patients or clients who are talking about like, I'm stressed, I have anxiety, I don't get great sleep, some sort of meditative practice?
Absolutely. First thing I actually focus on is talking about a mindfulness-based practice. So I love to talk about meditation. Meditation is probably one of my favorites. Meditation, journaling, biofeedback, yoga, breath work, whatever it is works for you. Specifically, I like meditation because there's a lot more research and people don't feel like it's so, right? I
Yeah.
talk a lot about how when you're able to kind of tap into that meditative state, physiologically, what's happening, you start to actually change your brainwave patterns.
Mm-hmm.
Most of the time, we're running around what we call a beta brainwave state. We're alert, we're active, we get stressed out, we go into a higher beta brainwave state. A lot of times, there's a little bit of like we're not as coordinated when we're doing that. There's not a lot of coherence in the brain. So we, can start to feel anxious and things like that. But when we step in or start to do meditation, what happens eventually when you have some practice is that you start to kind of step down into alpha, and then people who have more experience can go into theta and sometimes even delta brainwaves. It's a very restorative state, and it really kind of taps into that autonomic nervous system. It's like a back door into that system so that, again, we push into that parasympathetic nervous state. There's lots of research on like, what do they call it? Mindfulness-based stress reduction, which is
Mm-hmm.
really, meditation it has really profound effects. And for me, when working with clients, is really is the first place I start. And
Yeah.
because you got to change the way that your brain and your body is responding to things, because, you can eat all the organic or all the nutritious food in the world, but if you're still dumping so much cortisol, so because you're constantly stressed out, you're still going to gain weight, right? You're still
Right.
going to, cortisol is one of those anabolic hormones, right? And you're
Mhm.
really not going to be able to maintain that balance until kind of go from the inside out, I think.
I've tried to explain that to a lot of people, and everybody that listens to this podcast, they know like sometimes I've recorded podcast in like a closed closet because it's like sensory deprivation, and I feel like I can
Mm,
just like totally like channel in. Um,
hmm
and I've always every client I've had, and it's fitness and nutrition and all that, but I always make them incorporate some sort of mindfulness or meditation practice because I'm like, if you are still functioning from the same mental space as you were when you were binge eating and getting wasted on alcohol all the time and incorporating these things, then it doesn't matter how many times I get you to do these workouts or follow a nutrition plan, it's never going to stick because we're not rewiring the thought processes and like getting you in that state of like peace and relaxation to start incorporating a new lifestyle. But I'm
hmm
glad you touched on like what is actually happening because when I have people do this, they tend to fall off their meditative practice first
mm, hmm
before their workouts and nutrition because they don't get how it's impacting anything. So like we'll check in and they're like, I did my nutrition, I did my workouts, and I'm like, did you meditate today? And they're like, no, I don't really get it. Like I don't understand the point in it. So how
Yeah.
like somebody who does that, and I know there's people listening to this right now that are like, yep, that's me, like that's the first thing to go. How would you explain to them like why that is just as important as all the other work that we're doing when they're like, I don't really get it, like I don't see why I have to do this?
Good question. I think so. One of the things that I do, I actually, my patients kind of laugh at this. I actually draw like a little stick figure, like when we're kind of having our consult, and I draw like stress going to your brain. And then I talk about like, okay, got all these little arrows going to your brain from the stress. And some of those we can't take away, right? But how are we going to mitigate them or how are we going to manage them? And I think about mindset or, mindfulness practices as one of those ways because we're always going to have all these inputs. Yes, when you exercise and you eat right, you can physically see the results, which is a lot easier. But I try to remind people that you're going to have things that kind of come in and kind of interrupt your flow, right? There's going to be some weeks where you can't work out, or maybe you're on vacation and your diet's kind of off the rails. You can always breathe. You can always sit and
Mhm.
meditate. And I really try to stress that it really is the basis. It really is that thought process that kind of fuels all of that. I usually kind of bring it back to the physiology, and talk about, how the anxiety and the cortisol can kind of start to ramp up. But if we can keep the meditation going, it's really going to kind of, like you said, rewire your brain and really kind of change your thought process. And the more we kind of practice that, the more we do that, the easier it becomes, the easier it is for you to be more resilient to the stress so that when things pop up, you can stay on track a little bit easier. And doesn't it feel good to actually like be able to sleep during the night and to be able to think clearly, during your meetings and whatnot? So I always try to like tie it into something that's a little bit more tangible for them. Like maybe it's tied to their sleep, or maybe it's tied to, for a lot of my patients, is about performance at work, right? And them being able to perform in their meetings or do their job effectively. So I usually try to tie it to something tangible to make them kind of beat it over their heads. Like, no, you got to do this. This is good for you.
Yeah, and I like how you said too, like the whole resiliency, because it really like I love kind of figuring out a way of like, listen, if you ever want to know like all your insecurities and anxieties and your stress, all that has to happen is your routine has to get thrown off. That's it.
Yep.
Whatever your daily routine is, your comfort zone, your familiar zone, if anything like throws a wrench in that, immediately all your concerns and fears and anxieties are going to come up because you haven't really practiced like, all right, so like it's fine. Like my center is right here. Like I can stay present. Like I'm right here. So I like what you said about the mental resilience because it's true. Because if you have that to always come back to when everything else that's outside of your control happens, the one thing you can control is you have this breath work. You can come here just because like you're on vacation and you've totally like lost all routine doesn't mean that you still can't keep up with like some sort of practice that keeps you on the path of like keeping anxiety down and stress down and keeping things in check. And I think that that's what confuses people, is because it's like so much emphasis goes on like, well, I worked out 4 days a week and I did this, but like, and that's always what I hear. They're like, I kind of fell off because like I had family visiting and I couldn't stick to this routine. And I'm like, that's
Mm-hmm.
exactly why we do this though. It's the like daily practices and disciplines so that every time life changes, you're not completely thrown off. You have some sort of
It's really,
foundation.
yeah, it's really interesting because I often think of it as, you start the meditation or the mindfulness just because, you're stressed out. But when you get into it, it really is about like you change, you become a
Mm-hmm.
different person and you become, that person who's able to navigate without, it's like that meme where everything is fine and everything's on fire, but you're
Yep.
really not that it doesn't bother you, but you're just able to navigate it with a lot more grace, a lot more ease, and without losing your stuff, right? So
Yeah.
it's about who you become, I think. And like you said, like you can't have that same mindset and be this, fit, active person, but have that mentality of the person who's, chronically stressed and overeating all the time.
Right. It's true. I think you become less reactive and you're a little
Mm-hmm.
more in control. Like everything is not happening to you. You realize like there's a little breath before you have to react to things. I love that.
Exactly.
I love that we have the same perspective though on the whole meditation practice, just because like that is like a constant hurdle I'm having to get over with people, of really understanding the importance. And even for myself personally, and I'll like segue into this talking about like anxiety,
Mm.
people struggling with anxiety on a regular basis, is because I got into meditation years ago when I was like 20-ish, because I used to struggle really bad with anxiety and panic attacks. And
Mm.
there's a whole thing on the backside of like I was on birth control, so my hormones, then when I got off of it, were out of whack, and like all things were causing problems. But because I didn't want to go on medication, I didn't want to go on antidepressants or anti-anxiety, I started reading everything I could about meditation, mindfulness,
Mm.
how breath work can help reduce it. And I know that's like a lot of the content you share is on anxiety, burnout, and overwhelm. So I want to talk about that. Not, I mean, I think we kind of like got all into how meditation can do that. But with a lot of the things that you talk about with anxiety, and specifically kind of segueing this into people who are active, people who are already, they're like, all right, I'm doing the meditations, I'm eating clean, I'm doing the workouts, but I still have anxiety. What would be a couple, one, key things they can look out for? Like how, for example, maybe I'm struggling with burnout, but I don't really know how to recognize what burnout and overwhelm even looks like, because type A, I'm so used to just like, you just do it, you just push through, you just grind it out, you just put your head down. So, what does burnout and overwhelm even look like? We'll just start with that.
Okay. Good question. So burnout usually is kind of described as that state in which the things that used to take joy in really aren't doing it for you anymore. So say like you're the type of person who, loves to work out, loves to exercise. Like the thought of doing that is just not appealing at all. And physically, a lot of times you're having the inability to even mount a response or to even be able to have the energy to get up and go to the gym. Or maybe you are going through the motions, but you're not able to lift the same amount of weight and you just don't have it in, you're just gassed, right?
Mhm.
There's kind of several different stages to burnout. There's kind of like the pre-burnout phase where your body's kind of still mounting a response, but it's taking more and more energy to kind of get the same level of output. And then there's a kind of phase where you're just in the burnout. Everything's exhausting. You're irritable. You're just constantly feeling overwhelmed. That's usually when the anxiety starts to ramp up as well, because it's almost your nervous system is just taxed. And your cortisol has usually been so high for so long that your body is just kind of not even really mounting that response anymore. And then you get to kind of the post burnout phase where you slowly kind of start to recover. So, one of the key things is one, kind of really able, and this is where it's kind of hard and where working with someone can be really helpful, is kind of like recognizing when you're not okay, as far as
Mm.
like, I'm not enjoying things that I used to do. I'm irritable all the time. I'm not sleeping well. Maybe job performance is starting to falter, or you can't concentrate, you can't think, you can't remember anything. Like recognizing that and being okay, especially for my type A people, being okay with saying, hey, I need some help here. Like, this is not normal for me. And recognizing that it's okay and it's safe and it's good for you to say, I need some help, and kind of seeking that out, I think is kind of first step to really starting to recover from that.
Yeah, because I feel like this is something that I've seen. I, I'd say it's coming out more publicly, and I'm actually really happy about it, is because I think a lot of influencers and a lot of people out there were putting on this facade of just like hustle, work all the time, grind. I'm up at 4 a.m. I sleep 5 hours a night. I'm doing 2 workouts a day and I'm eating like this much, and they look fantastic. But again, we all know that social media is a highlight reel. It's not real life, just
Hmm.
the highlight reel.
Exactly.
But now more and more of those people are coming out and they're starting to talk about how like doctor says I gotta like kind of tailor back a little bit because I have adrenal fatigue. Or a lot of men, this is what's coming up a lot. A lot of men in their 30s having low testosterone, and then a lot of women also in their 30s having extremely low hormones because either under eating or overtraining or whatever.
Hmm.
And not even knowing that like that's not normal, that's not a normal thing, just because there's such a huge imbalance. So when you see things like this, so say somebody's listening to this, they're like, yep, my hormones are super low. I'm burned out. I'm exhausted. Like I'm barely just making it through the day. What can they start doing? Both from like, obviously, like, well, start saying no to more things, maybe like kind of like rein it in with your workouts, make sure you're getting like the basic things that most people know. Is
Hmm.
there anything else that people can start doing? Because I get asked a lot of stuff about this.
I think one, like you said, you start to pull back. You have to, this is where the mindset comes in. You have to kind of switch over and start to prioritize recovery, right? This is where, mindset shift is really important. We have to switch more into pushing more into the parasympathetic nervous system state. This is where we got to prioritize sleep. We either working with your sleep hygiene or sleep routine. So sleep hygiene being those things like, avoiding the blue light before bed, to help stimulate melatonin production, keeping the room nice and cool, those sorts of things. And having a sleep routine that's kind of preparing your body, preparing your mind to really wind down for the night. Anything that we can do to kind of bring that cortisol level down so that you can actually sleep. I think that's number one, because if you can't sleep and recover, it's going to be really difficult.
Mm-hmm.
Um, Next thing is, this is where we start to look at where I start to bring in maybe herbs and supplements to really help you kind of recover. At
That's what
this
I,
point, like, mhm.
sorry, I literally was like, do you have herbs or supplements that you recommend? So go ahead. That's perfect.
Yeah, so this is where, like, so if I'm working with somebody, this is where I actually use a lot of the functional medicine testing in some of the different labs to
Mm-hmm.
know exactly, okay, what are we deplete in as far as nutrients? Because a lot of times when we're stressed out like this, we're burning through a lot of different vital kind of minerals and nutrients that help to power a lot of our, different metabolic processes. So this is where I start to look at B vitamins, start to look at magnesium, start to look at glutathione, other antioxidants, and like kind of mitochondrial health. Aside from that, like kind of overall recommendations, this is where we start to bring in different types of adaptogens, right?
Mm-hmm.
To really help kind of, I don't want to say reduce, adrenal output or anything. I tend to think of it as modulating the adrenal response to things like cortisol. So this is where you look at your adaptogens, your ashwagandhas, your rhodiola, your chamomile, your, oh gosh, there's a million of them out there. Your ginsengs. It kind of depends on the person. Like, this is where I think it gets a little bit technical as far as, which one is going to be the right one for you. And for me as a practitioner, this is where I bring in the labs, because it helps me look at which pathways we need to kind of push or which pathways we need to dial back. And that helps me choose which herb or supplement might be the best. So,
Okay. So when you're talking about like labs, so say somebody who can't come to you in Seattle and they're like, all right, well, I want to go see a functional doctor.
mhm.
What lab should they be asking to have checked?
Oh, good question. So I like to look at a couple different things. A big one when I'm thinking about, nutrients. One, I usually start off with a stool test. So this is going to look at your microbiome. It's going to look at how well you're digesting things. If you're digesting, making sure that, of course, that we have a well-balanced microbiome. Do we need probiotics, prebiotics, postbiotics? Do we have inflammation in the gut? Like, do we need to heal some of that? Because a lot of that is really going to have play a big role in how well you're able to absorb, certain vitamins, minerals, or nutrients, or whether or not you're going to be able to really break down and utilize different types of herbs and supplements as well. So stool testing is a big one. Another one I like to look at is an organic acids test.
Mm.
So this is looking more at like your minerals and your nutrient status. That's usually a urine test that you can do at home. And sometimes there may be like a finger stick for a blood spot to maybe look at omega fatty acids as well, because those play a huge role in our cognition and inflammation. Um, those are usually kind of where I start before I even start to touch hormones, because usually if you can bring that into balance first, hormones generally will correct themselves.
Yeah. Okay. Yeah, the
Hmm.
with the herbs, it's ashwagandha is an interesting one because I know that's the one a lot of people go to. Ashwagandha makes me feel weird. Like, because a lot of people have asked about that. They're like, hey, I heard I should take ashwagandha. And I'm always like, start with like a super low dose because for some people, they're like, this is the best thing ever.
Exactly.
No, not for me. Ashwagandha it makes me feel almost like I'm a little bit drugged. Like it gives me like a
Hmm.
little bit of like, I feel so calm, but like almost like too calm, like calm and a little wiry.
Exactly. Yeah, there's so much with the different herbs. Like it may not be that that's not the one for you, and there's a lot of variability that comes into there, which is one of the reasons I say, like, yes, herbs and supplements are great. I love them. I use it all the time. But just because something is over the counter and doesn't require prescription doesn't mean you should just kind of go diving off willy-nilly, just because, like you said, there can be side effects. And
Right.
sometimes that can put you off from using other herbs or supplements because you had a bad experience. But it could just be that that one doesn't fit with your physiology for whatever reason.
Yeah. Do you have like staples? Like if you were like, all right, most people, I mean, I have mine, but I'm curious of yours, of like
Mm.
most people can find like these few things beneficial without having to do any tests of just like almost everybody is low
Mm.
in this.
Um, let's see. Are we speaking specifically like when being like thinking about overwhelm and anxiety or?
Let's talk about, yeah, like people who struggle with anxiety, also the people who are constantly like active, working out 4 to 5 days a week.
Okay. I would say kind of top shelf here, things magnesium, specifically like magnesium glycinate. Magnesium, one of the minerals that's probably present in all a crap ton of our metabolic reactions. And when we're stressed out, we kind of burn through it quickly. And our food, just because of the soil, things aren't as replete with magnesium as they have been in the past. So that's usually a big one. Magnesium helps a lot with muscle tension to anxiety to even kind of bowel movements as well. But I specifically really like magnesium glycinate. The glycinate really helps more with the kind of anxiety picture,
Mhm.
as well as it helping it to be absorbed a little bit better and not just kind of pushed out through the bowel. Let's see, B vitamins. We burn through B vitamins when we're stressed out. And again, they're present in a lot of like metabolic reactions, especially for like mitochondrial health. For, during the day when you're trying to relax or either trying to concentrate. I love things like L-theanine.
Mm.
Um, you can get it from green tea, but if we don't want the caffeine, an L-theanine supplement. Um, really great for focus and cognition. There's a lot of studies on L-theanine. It really gives that sort of feeling of calm and relaxation. If you're not taking something like a SSRI or other medications, things like GABA can be
Yeah.
helpful as well. Again, it starts to get a little bit tricky if you are on other medications. So I always kind of recommend just check in with your doc. They'll usually know if there's an interaction to worry about.
Yeah.
Phosphatidylserine is also another good one. Also really helps with sleep. There is a product that I love. It has phosphatidylserine, L-theanine, and I think it's GABA. It's called 200 milligrams of Zen.
Oh,
I
I think,
really,
yeah. I'm familiar with it.
yeah, I love that. I love that product. I have a lot of my patients on that one. A lot of times rhodiola as an
Hmm.
adaptogen instead of ashwagandha is another great one.
Yeah.
But I tend to say don't take that one at night. It can be
Yep.
it can be too stimulating. Let's see. I think off the top of my head, those are probably like top shelf recommendations, assuming we're not also like looking at gut health and things like that.
That was going to be my other question. Those yours are almost like exactly what I said. I'm like magnesium, B vitamins. What are your thoughts on people? I had somebody ask me this today of should I take a probiotic? I typically say it depends on the quality of it, and you don't really need as much as like the ones that are like 500 billion CFUs or whatever. And
Yeah.
I usually say there's strains too. There's specific strains that you need to make sure, depending on like what it is that you need. But if somebody's like, I can't go
Hmm.
get all these tests done, is it more beneficial for me to take it or not take it? What are your thoughts on that?
I would say if you're eating a standard American diet, take the probiotic for sure, for sure.
Right.
Like you said, like we can get real technical as far as like which one, which strains, which dosage. A lot of that depends on, if I'm working more with gut health and kind of doing a deeper dive, we may do a higher dose probiotic with specific strains, depending on, what you're lacking or what, you have is there an overgrowth, et cetera, et cetera. But yes, I would definitely say most people could benefit from just a, 5 to 10 billion CFU basic probiotic that you can pick up, at the Rite Aid for sure.
Yeah. Agreed. I love
Yeah.
I love all this just because like it's so nice hearing from another person who's just like, yeah, you need to do this, this, and this, and meditation and these herbs and
Hmm.
adaptogens. Cool. I don't think I'm just looking through my notes here to see if there's any other questions that I had gotten from people around this. People really wanted to know about like cortisol training,
Hmm.
overtraining, adaptogens, supplements and herbs, nutrition and macros. Like, should I do intermittent fasting, the keto, all that stuff? Um, yeah, I don't really have any other questions that are on here. I just
Okay.
like I love that you focus on everything with anxiety and burnout and overwhelm. And also like I told you, I stalked your stuff. I also love that you do acupuncture and sports medicine and all those things. And more than likely, I'm probably gonna have you come back because I'll like send this out and people will be like, oh wait, like I have more questions for you to ask her. But if anybody does want to reach out to you directly, where can they find
Mhm.
you?
So you can find me YouTube, Instagram, LinkedIn, Jessica Norton ND. So just my whole name plus the ND. Probably most active on YouTube, but if you want to message me, send me a DM. I'm on Instagram and LinkedIn as well. Yeah, and you can find out, if you're in the Seattle area and you want to come in, you can find out how to book with me, or if you want to work with me online, you can go to my website. Again, just jessicanortonnd.com, and you can find some options to work with me virtually. So I'm around. I'm out here.
I love it. Cool. Well, thank you so much. I appreciate you coming on here and sharing all your knowledge and expertise. And like I said, I'm sure we'll have you on again.
You are most welcome. I'm happy to chat, and I'd love to come back and answer any questions you guys have.
Awesome. Thank you.